Well, good morning, everybody. All of you should be very proud of how this city has handled this horrible crisis. And you should be proud of the heroism of so many in this city. I've said before, it's those who we honor so deeply, our healthcare workers and our first responders. It's also everyday people who have found ways to get through, to be there for each other, to deal with these new tough rules, but find a way to make them work for the good of everyone, for the good of their own families and the good of everyone. New Yorkers have been absolutely remarkable in this crisis. And I think one of the ways that people have excelled is in a very quiet way that needs to be talked about more and needs to be understood better, which is the way people have just been there for each other. The way people have remembered that the person they're with, a loved one, a friend, a neighbor, a coworker, someone from the neighborhood, that everyone's going through so much, and sometimes what's so important is just to be there for someone, just to listen to them, just to see how they're doing. New Yorkers have always been incredibly social people. And it's true, we have tough exteriors, but behind those exteriors beat hearts of gold. That's what I've seen for decades and decades, how good and compassionate and kind New Yorkers are. And New Yorkers look out for each other. We know it from our buildings where we live or our neighborhoods. So many ways New Yorkers have each other's backs. And in a crisis, it really comes through. So just those little things, when you say to someone, how are you doing? Are you okay? How are you feeling? People need that. They need that moment of empathy. They need to hear someone's concern. Sometimes they just need a chance to unburden themselves, all the stress they're going through. Just that simple question, how are you holding up? Can mean so much to someone. And I see it all the time, and I appreciate it. I appreciate all of you for having that spirit, for understanding people need that chance to be heard and just to express what they're going through. And that compassion matters especially when it comes to people's feelings, when it comes to their mental health, because it's still an area as a society we're still grappling with how to talk about mental health, how to act on mental health. It's still an area where there's so much stigma. There shouldn't be. It's part of human life. Mental health is no different than physical health. It's part of who we are as human beings, and yet that stigma still pervades in so many ways. And so just that act of asking someone how they are and inviting them to speak openly is powerful. Now, it need not be said that this is not just a New York City reality, that mental health doesn't get talked about in the open. It's true in our whole country. And it's true that there's never been an effort in this country to actually bring this in the open and treat mental health conditions consistently. There's not a place that people know to turn. It's not the way we grew up. And then you, on top of it, think about that stigma and add to it a pandemic and all that brings with it. Think what it means for families who have lost their loved ones, the pain they're going through, and all they want to express, and many times they don't know if it's okay to express it. Think about the senior citizens who have been isolated, how much pain there is to not be able to see your grandchildren, for example, or just not get the visits you're used to having from neighbors. Think of what that feels like, and yet what do they do with that? Where do they turn? Think about how parents deal with this incredible anxiety of not having a paycheck, and how they express that to their families, what it makes them feel. So all New Yorkers are dealing with these challenges, and we want to make sure there's help for everyone. I've talked yesterday about our kids, what they're going through. We want to make sure there's help for them, and we're going to focus on them a lot. But I don't think I even have to say, when you think about who's gone through the most in this few months, the most trauma, the most pain, the things that would dredge up the deepest, sharpest feelings that somehow have to be aired and addressed, well, that's so many of our healthcare workers and our first responders. And for some of them, and you've heard the stories of places like Elmhurst Hospital, for some of them, the only parallel to what they've gone through is what soldiers go through in war. And there's a phrase, combat stress, and there's a field of combat mental health, because it's understood that soldiers go through so much. And the way to deal with any mental health reality is not to ignore it, but to take it head on. And the military understands that. I just met with some of the amazing officers from the U.S. Army who are doing this crucial work, who have learned the lessons of what our soldiers go through in war and have understood what they need to address it. And they're going to be helping us, and you're going to hear about that in a moment from our First Lady. But that phrase, combat stress, that's a wartime term, and Charlene and I know something about it because both our dads served in World War II and brought back a lot from that war. And I've spoken very openly about what my dad went through, the scars he brought back, both physical and emotional, and how much it framed the rest of his life. But that phrase, combat stress, wasn't really known the same way back then, and the support wasn't there. But now our military does provide it in a very powerful way. And I never thought we'd have to use this word in the middle of New York City civilian life, but in fact it is the right word, and we do need the help of our military to make sense of this situation. Think about what our doctors, our nurses, our healthcare workers have gone through. Our EMTs, our paramedics. Think about the people they've had to watch pass away before their very eyes. Think about the fact that they are surrounded by this virus and they're fighting it and they're walking toward the danger, but they also have to think about what it means for their own health and what it might mean for their family, and what happens if they want to go home and see their family. So they're carrying that burden. I'm sure a lot of them sometimes feel alone, and we can't let that happen. We can't let them carry that burden alone. We have to be there for them. Now, the idea of providing access to mental health services has been a core notion for this administration for the last 6 years. That's why Thrive NYC exists, to break down the barriers and open up access to mental health. And that initiative was for all New Yorkers of all kinds, but we've also had specialized initiatives for our heroes, because we've known they've dealt with challenges before. No one could have imagined this pandemic, but they were already dealing with challenges. And there's two programs I want to mention that are particularly good examples at health and hospitals: the Helping Healers Heal program. And a lot of our healthcare workers are leaning on this right now. It's a 24/7 helpline for doctors, nurses, staff. Any health and hospital staff can call it, 646-815-4150. And the FDNY has had a counseling services unit. It's renowned. It's a gold standard for the whole nation. In fact, other cities have sought out the FDNY's guidance in how to set up a similar approach. A very poignant example, and a painful one, was after the Parkland shootings in Florida. Folks in Florida turned to the FDNY to know how to provide that ongoing support to first responders. And our paramedics and our EMTs have been right there at the front line of this crisis. They need that help. And so I want to make sure FDNY members know you can call 212-570-1693. So these initiatives are up and running, but we need something even more in this moment of crisis, and that's where our military come in. And what they have been doing these last weeks, the military has been helping us in so many ways. I want to thank all those who come in to help in our hospitals, the extraordinary contribution they've made to fighting back the coronavirus. Now, they're going to play a crucial role in addressing the mental health challenges as well. Now, to tell you about this extraordinary partnership with the Department of Defense, with our armed forces, I'm going to turn to the First Lady, and I'm going to say it this simply. She has devoted her time as First Lady to breaking down the stigma that stands in the way of people getting the mental health services they need. She's really helped this whole city to have the right open conversation about what's going on inside all of us and how we have to bring it out in the open and ask for help, and how help needs to be there for everyone with no stigma, no barriers. In this pandemic, she's taking that same impulse, those same lessons, and working to make sure we reach more and more New Yorkers who are going through so much. I want to thank her for that, and particularly for the work she is doing to bring these extraordinary military professionals in to help us further. So now I'll turn to our First Lady, Chirlane McCray.
Thank you, Bill, for your leadership and especially for your compassion. For weeks now, all our frontline healthcare workers, who I think of as our soldiers of grace and mercy, have been pushed to the limit. Inside our hospitals, we've had battlefield conditions with triage and fear in the hallways. But when the emergency field hospitals and morgues close, after the TV crews leave and the clapping stops, our soldiers, our healers, go home. And we have to wonder, how do these healers manage their stress after seeing so much death and suffering? Their emotional state is a crisis within a crisis, and an urgent mental health emergency. And that's why we are working with the Department of Defense, which has brought together a joint force from the Navy, the Air Force, and the Army. They are experts in dealing with combat stress and have a unique insight into how to help those who provide care in this kind of setting. The Department of Defense will train 1,000 behavioral health staff in helping healers heal, champions as trainers who will further train H&H, Greater New York Hospital Association, FDNY, and EMS staff. The Department of Defense will also conduct assessments, sharing advanced decompression and wellness strategies for combat stress management. This work with the Department of Defense is a critical new piece of what we are doing for all of our essential frontline workers in New York City. So how will we provide more support for our healthcare workers? Well, these DoD trauma specialists will look at individual hospitals and also the entire system. You know, every hospital is different. They'll want to talk to frontline leadership to get a picture of the most pressing mental and emotional needs. And they'll add to the programs, training our team on combat stress. At first, they'll do small groups from FDNY, Health in Hospitals, and private hospitals will also be trained. And next, we'll train more than 1,000 Health in Hospitals personnel and other staff. The Department of Defense will provide a whole new higher level of trauma care for those on the front line. Our heroes will have the opportunity to receive an individual assessment. And all of this work is already underway. We're ramping up to be fully operational in May with the program fully in place by June. This is not the time, nor is it appropriate for us to hide the level of stress that is experienced by our nurses and doctors and medical technicians. We have to face this head on. This is not something that we should be secretive about. And I have to say that once again, New York City is a leader in this effort. No other city has a comprehensive mental health program for healthcare workers at this scale. And it will not be a one-off. This program, with the trainers and other resources, will be incorporated into our healthcare facilities so that even long after this pandemic is over, our healthcare workers will have these services. I want to thank the U.S. military, H&H, Office of Emergency Management, and the New York Fire Department. The service of our frontline healthcare workers is beyond what anyone could have rightfully asked. They have inspired a city and a nation, but it comes at a steep price. In recent days, we've lost John Mondello, an EMT working in the Bronx, and Dr. Lorna M. Breen, an ER medical director at Presbyterian. Please join me for a moment of silence in their memories. We owe these workers the world that we will enjoy after this virus is defeated. And we will not forget them. We will not forget this debt. When people ask our hospital workers, what did you do during the great pandemic of 2020? With pride, I showed up. I did my. We want them to say, best, I saved lives because my community supported me. I was able to take care of myself while taking care of others. And I stayed healthy in mind, body, and spirit.
Thank you, Shalane. That's a beautiful sentiment, and it's exactly the spirit we have to bring to everything we do to support our heroes, and this incredible initiative with the U.S. military is going to help us do it. And remember, every single one of you, every time you say thank you to a healthcare worker or a first responder, every time you applaud them, every time you ask them if they're doing okay, if there's anything they need, that helps so much. But what our military is going to do is going to be outstanding, because we've seen they bring a special ability, and their presence, as I said, in our hospitals, not only their skills, but that extraordinary confidence it gives everyone to see them present has been really, really crucial to getting through this crisis. So thankful to everyone who's brought together this new initiative to address the combat stress that's the reality for so many here. Now, there's another important new approach we're going to take to protect our heroes. And it is to give them more information about what they've experienced during this pandemic. I want to talk to you about testing. And what we've talked about before is the coronavirus test. It's called the PCR test. And that is the test that answers the most immediate question at this exact moment. Are you infected with the coronavirus? That's the test that is crucial to so much of what we're going to do going forward. That's the test I wish we had had a lot more of when we needed it earlier on. But there's another test that really will provide a lot of help and support as well. And that's the antibody testing. And I'm going to talk to you about a new initiative that will reach so many of our healthcare workers and first responders. And I'm going to tell you why this is so important and the sweep of what we're going to do here. I'm also going to give a few qualifications, because it's important to recognize what we know and what we don't know when it comes to antibody testing. But here is what we do understand, that a particularly good antibody test, there's many different kinds, but the ones that are most accurate and effective give you a clear indication of whether you have been infected by the coronavirus previously. And they give you some real confidence, because here's what we can say. Anyone who has been infected and came through obviously had the ability to beat this disease. Knowing if you've been exposed to it is powerful information. Our healthcare workers and our first responders who are dealing with folks who might be infected, it is going to give them additional confidence to know if they've been previously exposed. Think about what it takes every day to get up and say, I'm going to go where the COVID-19 is, where I know it is. The folks who go into the hospitals, the emergency rooms, the ICUs, the paramedics, the EMTs, all the folks who know they're going to where the danger is, they're of course thinking of their families, their own families too. So having a sense of whether you've been exposed previously is very important. And giving the best answer we can brings a lot of value. On top of that, we are seeing really impressive results with treatments based on plasma that needs to come from those who have already been exposed. So there's a growing hope that when you identify people who have been exposed, you're identifying folks who can then give blood that then allows for the treatment of more people who are sick and help save lives. And we know one thing about our healthcare workers and our first responders: they are doing this work because they care so much about saving lives and helping other people. So knowing that they could be amongst those who give blood that saves other lives is entirely consistent with everything they've devoted their lives to. And then there's the fact that we're going to get information that can help us fight this disease. We all understand, the entire global medical community is still trying to understand the coronavirus, figure out the best ways to fight back. One day there will be a vaccine, one day there will be a cure, but the more information we gather, the more likelihood we get to that day sooner. So antibody testing brings a lot to the table. And our goal is to reach a lot of people who would like to take advantage of it on a voluntary basis, of course. But I'm talking about our healthcare workers, I'm talking about our police officers, our firefighters, EMTs, paramedics, correction officers, so many who would like to have this opportunity, and now it will be provided for all who want it. So, thinking about our healthcare workers, thinking about our first responders, we are initiating a plan to reach 150,000 of our heroes and give them this antibody testing, to give them that knowledge and that peace of mind, and to ensure that they are also helping us take the next step in fighting this disease. We have agreed to a partnership with the federal government, with the Department of Health and Human Services and the Centers for Disease Control. And more details will be announced in the next few days. But the plan is to begin as early as next week to offer the tests in hospitals, at firehouses, at police precincts, at correction facilities, wherever our healthcare workers and our first responders are, to make the tests readily available. Again, this will be provided for free. The federal government is covering the cost, and it will be provided to all who want to take advantage of this test. Now, I mentioned that I'm going to say the antibody test, no one is claiming it is perfect. It does not tell you, the best of I understand from all of our healthcare leadership and from listening to Dr. Fauci and others, it does not tell you if you're entirely immune in the sense we all think of that word. When we hear the word immune, we think you just can't possibly get something again. There is not yet confidence that having been exposed to the coronavirus once means you can never get it again. Now, common sense tells us if you were exposed once and you made it through, you're in very good stead. You're in a very good situation to make it through again if you ever were exposed again. But we don't know for sure if anyone can contract this disease a second time. The good news is, honestly, there's not a lot of evidence that people have, but we don't know for sure. So that's a limitation that we have to be clear about. And it's also important that even folks who get a positive result do not think that means that they can let down their guard. Now, I'm not saying people would think they're invincible, but they have to be really clear that there still are dangers because we're dealing with an unknown disease. We're dealing with so many questions. So for healthcare workers and first responders, they would still continue in their work to wear the PPEs just as they were previously. And we still need to practice the same concepts, the social distancing, and we still have to be watchful for symptoms even if someone has tested positive. But again, it's not a perfect test, but it does give real information. It is helpful. It tells you something very important, and it's part of solving this bigger puzzle of the coronavirus and fighting it back. So this, again, more details to be announced, but a wonderful step forward and a huge initiative. The goal is to reach 150,000 of our heroes. Now, let me talk about another effort to protect people. And this is now about how we protect some of the very most vulnerable in New York City, homeless New Yorkers. Again, the compassion I talked about earlier. New Yorkers feel tremendous compassion for folks whose lives in some way came unraveled and they ended up on the street or they ended up in shelter. So a few weeks ago, I told you we had a goal of having 6,000 homeless in hotels rather than congregate shelters to make sure that people were safe. And that goal has been reached. And now we are going to go farther. This week, we will move an additional 1,000 homeless individuals from congregate shelters to hotel facilities. The priority will be on folks in those larger congregate shelters that are having more trouble with this social distancing. And there's going to be a constant effort to evaluate all shelters, and wherever there are social distancing problems, continue to take people out of the shelters into hotels. 1,000 this week. We are prepared to do 1,000 more each week going forward as the need indicates, because we want to make sure people are safe. Now, again, there are real reasons for people to be in shelters who need the services in shelters. So for some people, it actually can be much, much better to stay in the shelter setting. But we've got to make sure there's enough space. We've got to make sure that we strike that balance. We're also going to provide additional medical oversight. Our Health and Hospitals team is going to work with the Department of Homeless Services to bring additional medical oversight to all homeless services sites. The goal is to constantly be vigilant for anything that might pose a danger to homeless New Yorkers. And starting this week, we will begin a program of testing homeless individuals at homeless services sites. Of course, anyone who tests positive will be isolated. This initiative will begin this week and expand over the next couple of weeks. The goal is to reach across the entire shelter system by the middle of May. All right, a few more things before we turn to our colleagues in the media. And we've talked about some serious and somber topics, but now let's turn to something I think people are going to be happy to hear about. And, you know, look, when our lives changed so profoundly over the last weeks, it's almost been impossible to take stock of all the things that are different and the things we miss and the things we need that we can't have right now. And some of those things are going to take a while longer, but there are other things that we can start to bring back, if only online for now, later in person. But there's some things that we need to make available to people online that could really change their lives for the better. And we know there were a lot of folks in the weeks leading up to this crisis who were planning on doing something absolutely beautiful. They were planning on getting married. And Shirley and I are coming up on our anniversary on May 14th, 26 years. And we know what a beautiful reality marriage is, what it means to people, how it frames their whole lives, and yet folks haven't been able to get married in these last weeks. So the good news is we're going to have a very, very good new visitor in our city. Cupid is coming to New York City. Project Cupid will allow couples to get married online. And this will start later on next week, and it'll be available in 11 different languages. And this is a great team effort. We want to thank Speaker Johnson, the City Council. We want to thank the City Clerk's Office and our colleagues at Do It, our Information Technology Department, who all put their minds together in a spirit of love and said, how do we figure this out? How do we get back in the marriage business and help people who are ready to tie the knot do so online? So again, not this week, but late next week, this will start up. And information will be available at nyc.gov/Cupid. And I want you to know, this is such a great example of New Yorkers saying, you know what, even in the face of a pandemic, we're not going to let it change us, and we're not going to let a pandemic stand in the way of love. We're going to let people get married and go forward with their lives and look to the better days ahead. Okay, let's now talk about what we talk about every single day, which is the daily indicators. So as I go into them, I can say we've had a good day, not a perfect day, but a good day. And we got to keep pushing, and we got to keep doing better. So the first indicator, unfortunately, is up. The daily number of people admitted to hospitals for suspected COVID-19 went up from 112 to 136. But the other indicator is going in the right direction. Daily number of people in ICUs and our public hospitals for suspected COVID-19 down from 745 to 734. Percentage of people testing positive for COVID-19 citywide down from 27% to 23%. Public health lab tests down from 56% to 29%. That's great. So progress, like most days we've seen, progress, but not what we still need fully to get everything going down in the same direction. Now, we're going to talk, I am certain, about the challenges of maintaining social distance. And I can tell you, we have to stick to it. And yes, we're about to have warmer weather lives. We got to stick with it. I'll just close before saying a few words in Spanish, and then we'll open to our colleagues in the media that, you know, we're going to be spending a long time trying to figure out everything that happened here in terms of the human impact over these last months, and certainly the months ahead. And the mental health piece of this is in some ways probably going to be the hardest to make sense of. As we always say, it's different than the physical reality or the physical scars. The mental scars take longer to uncover and process and make sense of. But so many people are dealing with these challenges in one way or another. The bottom line, as you heard from the announcement today, whether you're one of our heroes, whether you're an everyday New Yorker practicing social distancing, whether you're a parent trying to support your kids, whoever you are, you're not alone. And we're going to be there for you. And 24 hours a day, 7 days a week, multiple languages, and for free. Anyone who needs help can call 888-NYC-WELL and get a trained counselor and get that support. Lots of people are doing that, and it's helping them through. I want to invite anyone who needs that help to take advantage of it. A few words in Spanish. Esta pandemia ha resultado en una crisis dentro de una crisis, ya que afecta a la salud mental de tantos neoyorquinos, a nuestros trabajadores de salud y de emergencia les afecta mucho. Y necesitamos ayudar a todos los héroes que nos ayudan. A nuestros héroes les vamos a dar el apoyo que necesitan para llevar este cargo, para que vuelvan más fuertes que nunca. With that, we will turn to our colleagues in the media. And again, always remember to give me the name and the outlet of each journalist.
Hi, all. Just a reminder that we have First Lady McCray and Police Commissioner Shea here in person. And on the phone, we have Fire Commissioner